I am the small, black and white striped mosquito called Aedes aegypti. Unlike the night biters, I feed in daylight quietly, quickly, often unnoticed. While you scroll your phone, eat lunch, I land on your skin. Within the fraction of time, my thin proboscis pierces you. Along with my saliva, the dengue virus enters your body. The virus first infects immune cells in your skin. From there, it spreads into your bloodstream and begins to multiply silently. For the next 4 to 10 days, you may feel completely normal. This is the incubation period. In fact, nearly 3 out of every 4 infected people never develop any symptoms at all. Among those who do fall sick, more than 95% recover completely with proper rest, adequate oral fluids, and simple analgesics such as paracetamol. Their fever settles within a week, their strength slowly returns, and life goes on. But in a small fraction of people, the disease takes a dangerous turn. The first warning doesn't sound like danger at all. It begins when your fever, after days of burning at 104 degrees Fahrenheit, suddenly falls. You think you are recovering. But in dengue, the fall in fever marks the entrance to the critical phase, the narrow window where the body becomes most vulnerable. Then the true warning signs appear, each one a quiet escalation. A deep, unrelenting abdominal pain coils within, tightening like a knot. Even a gentle touch triggers sharp abdominal tenderness, a pain that warns of internal strain. Persistent vomiting begins, episode after episode, draining your strength within. Your behavior shifts. An overwhelming lethargy, or sudden restlessness and irritability, subtle changes that serve as internal alarms. Then the bleeding begins, each signal its own warning. Mucosal bleeding from the gums, caused by fragile capillaries and low platelets. A sudden nosebleed, as tiny vessels rupture under weakened clotting. Blood staining your spit, streaks reflecting fragile oral capillaries. Your liver enlarges, tender beneath the ribs, responding to inflammation deep inside. Fluid starts to accumulate silently. The abdomen swelling with ascites, the chest gathering fluid around the lungs, the ominous clinical fluid accumulation that signals rising risk. And then comes the most decisive sign, the one doctors watch with absolute vigilance. Inside you, the integrity of your blood vessels falters. Plasma begins to seep quietly into surrounding tissues, and the body slips into a state where danger hides beneath the surface. A rising hematocrit paired with rapidly falling platelets hints the plasma leakage, and that the body is approaching the threshold of shock. These are the warning signs of dengue, not the fever, not the rash, not the aches, but the subtle changes that quietly signal your body needs careful attention. I am Aedes aegypti, and I know that danger arrives not with the fever, but with the illusion of recovery.